All right. Hello, everyone. Welcome to Chapter 13, Stress and Officer Safety. All right. So stress is something, really that everybody experiences at some point in their life. It could be in your personal life, cause you stress. Your occupational life can cause you stress. Like, stress is something that is present in most of our lives, in different facets. So stress really isn't something that's particular to policing. But the stress that police officers encounter can be different in some ways than stress in other occupations, and it's really particularly relevant to policing due to the officer's ability to use coercive force and the kind of decisions that officers have to make. If they're under a lot of stress while they're doing that, that can cause problems. Okay, so first we're going to talk kind of generally about stress. So kind of most broadly, we're talking about two kinds of stress. You have physiological stress and psychological stress. Physiological stress is like the biological effects of stress. But psychological stress is more the mental side. Okay, so that mental side is much more difficult to evaluate than the physical side. Because of this, some call psychological stress anxiety, and when they say stress, they're referring to the physiological stress. So also at its broadest, stress is the body's response to some demand placed upon it. Okay, so it could be any type of demand, right? Any kind of demand placed on the body can result in stress. So stress can be what's known as eustress, which is positive stress, or distress, which is negative stress. Okay, so positive stress would be like stress that you put on your body from working out. Okay, that would be positive stress. Distress is the most common kind of stress that people think about when they're discussing like being stressed out, right? That would be distress. So then within this realm of negative stress, stress can be either acute or it can be chronic. So acute stress is like emergency stress, like stress that surprises someone, like police context on things like shootings, high-speed chases, like things that just happen, right, and cause all kinds of stress. Where chronic stress is more just this low-level kind of stress, just on the day-to-day kind of routine of policing. All right, so policing's always been considered to be a high-stress job. But the research really doesn't necessarily show that police work in and of itself is really any more stressful than other jobs. Now, are there aspects of the police job that are more stressful than other jobs? Of course, right? Of course there is. But when you're talking about is policing a stressful job, you can't just look at these acute times where policing is very stressful. You have to look at policing as a whole, like the day-to-day, the highs and lows. Like, so is it any more stressful than any other job? So the research doesn't really necessarily play that out, that shows that police work really is overall much more stressful than any other job. But again, regardless of whether or not we really think policing is more stressful, it doesn't really matter for our discussion, because we're going to talk about it anyway. And again, because they may not experience more stress, you really can't diminish the fact that the outcomes of that stress, because of the power that police have, right, that makes this very, very different. Okay, so if we talk about what causes stress for police officers during, just in general, like what are the main stressors? Well, who you talk to, like that's going to really depend. So you can talk about, like, there's 5 kind of distinct categories. Okay, and these are kind of broad categories. So things like the work itself. What do the police actually do? Those things cause stress. Okay, you have the police organization. How does the organization do that? Okay, you have the criminal justice system. You have the public or the community, and then you have personal life and family. Okay, so if you're talking about the job at stress, you're talking about things like shift work, exposure to dangerous situations, terrible situations that aren't necessarily dangerous, frustration with solving cases, like all those kind of things that go into police work. Okay, the organization creates stress, in much the same way that organizations create stress for other people, right? The bureaucratic stuff, the policies, the procedures, the supervision, like all those aspects. If you have a job working for an organization, like the ways that thing stresses you out is a lot of the ways that a police organization is going to stress people out. Criminal justice system causes stress. Court appearances. Police often feel like they're not supported by other portions of the criminal justice system. They think they're being too lenient with criminals. Like, because they're a piece of this criminal justice system, they feel stressed when the other parts of the criminal justice system maybe don't do what they want it to do or what they think it should be doing. Relations with the public, okay, those obviously can be stressful. The police may feel like they're not being supported. The public may lodge complaints. Like, there's a lot of things within the public/community that can cause police stress. And then also stress on the family. Okay, again, shift work, all the things that disrupt family life. Officers don't want to talk about what they experience at work with their spouses, so spouses sometimes think they're like hiding stuff, and there's a lot of aspects of policing that causes stress on the family. So then when you're looking at the book, right, the book then talks about a whole variety of studies that examine like more specific kind of stressors. There's 5 categories I just talked about. Those are real kind of broad. So then these studies look like really kind of dig in there and try to figure out like what are the main stressors. Now, I'm not going to go into all those studies, but be sure to read them, go through it, familiarize yourself with those. So those kind of record, I don't know what you want to call them, but more of the common types of stressors, okay? But there's some other sources of stress that are becoming more and more relevant that really haven't been looked at extensively by research. Okay, so one of the newer sources of stress is this transition to a lot of community-oriented policing. Now, some of the sources of stress from that are stressors that are common in any kind of organizational change, right? So if you're talking about going from more traditional policing to community-oriented policing, there's going to be any kind of organizational change causes stress for people because things change, right? And you may end up with more role ambiguity, more role conflict, like what am I supposed to be doing? Who's my boss? Like all those things that can cause people stress from a change event, excuse me, can happen when you're transitioning to community-oriented policing. But then you have other sources of stress that are much more specific to community-oriented policing itself, okay? Because now officers are having to participate in other types of activities than maybe what they're not used to, what they're not prepared to do, or maybe they don't want to. Right? All those things can cause stress. Another newer source of stress that's particularly relevant in the current policing environment is stress from negative media coverage, increased public scrutiny, threats of litigation. Okay, so media coverage of negative police events can lead to stress for officers, and officers have nothing to do with what happened, but just the coverage of it. The public hears about it, the police hear about it. So this negative coverage can do it. Also, it's become more recognized that female officers and officers of color may experience stress differently than white male officers. They also have other types of stressors that white male officers may not be dealing with, things like harassment, discrimination, bias, lack of feeling of belonging. Like all those things can cause additional stress for police officers. All right, so that's kind of what causes the stress. Now let's talk about what are the outcomes of this stress. All right, so one of the ones that has become more prevalent, or maybe not more prevalent, but just people know about it more, is post-traumatic stress disorder. So PTSD. This is generally caused by psychological stress caused by exposure to crises or traumatic events. So common events or events that commonly may lead to PTSD are things like shooting somebody, being shot, witnessing child abuse, rape cases. Like there's real kind of traumatic kind of cases and traumatic type events. But there's any number of types of events that can lead to PTSD. Okay, and the thing about these sorts of stressors is these are very, very person specific, right? Some people deal with things that it's fine, it doesn't bother. But other people, right, it causes reaction. So the thing about stressors, if you're looking at it from an organization, is those things are very, very officer specific. Okay, so one way that departments have attempted to try to help those that have been exposed to those kind of events is with critical incident debriefings. So it's essentially a counseling session to discuss the event. And these types of things are very, very common in policing. But are they effective? Well, research questions that, right? Several studies have found that one debriefing after a critical incident really didn't have much effect. And that one study actually found that if you have one debriefing, it actually has a negative impact on the officer. Kind of like it's making them relive this thing, and then they're having this negative reaction to it, and then there's no follow-up after that. So debriefings are probably good, counseling is probably good, but it probably needs to be more than just this one kind of debriefing session. Another factor that compounds this issue, the mental health issue, stress, like all those things, is that a lot of police officers might ask for help, right? If they're struggling with a critical incident or struggling with their mental health, because there's this stigma associated, and kind of generally, right, kind of in society, there's kind of this stigma sometimes for people that seek help for mental health issues, but especially in policing, there's a stigma associated to that. So they think that maybe like sensitization training early in an officer's career can help mitigate some of the stress from those kinds of events. The department should also offer stress management programs, stress management education, peer counseling. Like they need to offer additional services other than just like one debriefing to help people. Stress can also lead to the abuse of alcohol, drug use, suicide. Those are certainly negative possible outcomes from stress. Okay, and the abuse of alcohol may be especially prevalent among police officers due to, well, one, it's legal, right? Alcohol is legal, but also cultural and environmental factors. And this is true not only in stressful situations. Okay, so I'm not sure we really need to get into all the ways the book talks about how officers abusing alcohol can be detrimental to both the officer and the department. Like I'm sure you guys are pretty familiar with like what can alcohol do to me if I'm abusing it and I'm a police officer. But one thing that is somewhat surprising is how many officers in these studies admitted to drinking while on the job, like while they're actually working. Right? One study found like 25% of officers admitted to drinking on duty. Right? And so if abuse of alcohol is a problem, like this is certainly a problem, right? Officers drinking on duty, like that is certainly a problem. So what do we do about it? What's to be done about officers having drinking problems? Well, the first thing departments have to do is admit that there's this relationship between strain and stress and alcohol use. Like, because prior to this, departments just would dismiss officers. If you develop a drinking problem, like you're out. Okay, but that doesn't solve the problem, right? Because those stressors are still there. Now maybe you get lucky and you get an officer comes in, can handle that stress, no big deal. But you may get another officer in there, replacing the one that you got rid of, stressed out, starts having a drinking problem, right? So not admitting that there's this relationship that may lead to alcohol abuse really just compounds the problem, okay? So they have started to do that. So in kind of recognition of this fact, departments have to start developing some kind of treatment programs, counseling, offering treatment. So it's kind of hoped departments that take this real proactive approach, have education programs as well as other programs for officers, may have more positive outcomes. Like maybe able to get the officers the help they need, and then everything moves on, and everything's fine after that. Officers may also abuse drugs. This problem is less studied, and obviously it's less common, because the number one drug that people abuse is narcotics, right? So that's illegal on the face of it. So how much it occurs really is pretty unknown. Most departments have some type of drug testing program, Some of it is like if we think there's a problem, you test, or they randomly select a certain number of officers on some kind of rotation. But officers found to be using drugs are generally dismissed. Drugs and narcotics are certainly looked at differently than alcohol. All right, another negative possible outcome for police officers and stress is suicide. There seems to be this perception that police officers are more at risk for suicide than other occupations, and that may be true in some instances. But regardless of whether or not police are considered to be more at risk than other populations, like suicide is still a problem within policing. And again, compounding this is officers may not be willing to ask for help because they don't want to appear to be weak. So departments need to be sure to have some type of suicide prevention training. Then a book talks about 10 specific things departments should do to decrease chances of suicide. Make sure you go through those. So regardless of the cause, police officer stress is an issue, and departments need to take measures to address it. So then the book also lists 10 specific ways that departments can do that. So be sure to read those and be familiar with those. All right, let's move on to officer safety. So the reason they have safety and stress in the same kind of chapters because they're related, right? So these issues of danger, issues of safety within policing, right? These are one of the most commonly discussed topics, and the danger and safety aspects of it can cause stress for officers. So if you look back through time, like for decades, the number of officers being killed feloniously has decreased. Okay, now there's a lot of reasons for this. Now the last few years there has been an uptick in officers that have been feloniously killed. But prior to that, for decades, the numbers were going down. But officers are also killed or end up dying in the line of duty for multiple other reasons. Last few years, COVID was one of the biggest ones. But accidental deaths, things like car accidents, getting hit by cars, drowning, like there's a variety of ways that officers end up dying while they're on duty. But advances in training, having safer equipment, like all those things have contributed to this decline in officer death. All right, so how dangerous is police work? Right, it can be very dangerous. It can also be very not dangerous. I used to tell people when I was working in the field that working in law enforcement is hours of boredom interrupted with minutes or seconds of craziness, and I feel like that holds. Okay, you spend a lot of time. Not a whole lot happening, just kind of doing routine things. And then all of a sudden, something happens. And you have these minutes or seconds of craziness. So there's a lot of times where it's very dangerous and other times where it's not very dangerous. So if you're talking about danger, there's kind of these three perspectives that you can have. So the first is perceived danger. And that's an individual or group's belief about how dangerous something is. Like how dangerous do I think this is? And of course, there's a lot of factors that can influence how dangerous someone thinks there is. So if you're talking about perceived danger, like what do police officers perceive the dangerousness of their job to be? Or what does the public perceive police officers' job? How dangerous do they perceive it to be? There's also potential danger. Okay, that's related to potential situations that could become dangerous to an officer. Things like a felony car stop, right? They're not necessarily going to be dangerous, but they have the potential to be dangerous, right? All right, so then you have actual danger. So actual danger is the actual number of rates of injuries, rates of deaths that result, from accidents or attacks from citizens, right? What's the actual danger from those type of events? Okay, another way to think about danger is how did it happen? So you have situational danger, which is danger posed by a particular set of circumstances, such as risk of a car accident while driving, right? What is the situation? What are the circumstances in that situation that pose danger? And you also have person-initiated danger, which is an attack by a person. Okay, so one of the things that makes policing kind of unique when you're talking about dangerousness is rarely do occupations have both the situational and the person-initiated danger. Okay, and that's one of the major reasons that perceptions of policing as a dangerous occupation is so high. Okay, so if you look at the book, it discusses how dangerous policing is compared to other occupations. And policing really doesn't rank all that high. But when you think about the dangerousness of those other occupations, the threat scenario in those are pretty clear, right? A lot of times it is all situational danger, like logging. That's a very dangerous job, but it's all situational danger, right? The circumstances of how they're doing their job, when they're doing it, all those things contribute to that danger, where they don't really have the person-initiated danger, right? Where policing, you have both. So this unpredictability of people is something that adds to the dangerousness of policing. Okay, so then the book goes on, discusses some various studies that try to determine when officers are more likely to get hurt or killed. Again, I'm not going to go into all of those, but let's move on and let's talk about what can be done to increase safety and reduce police fatalities. Well, the first is training. Okay, so, and training has made huge improvements over the years. So in high-stress situations, officers should be relying on their training to act appropriately. So training should be consistent. It should be updated with the most recent best practices. Okay. Another important area is officer equipment. Okay, providing officers with less lethal options can also decrease injuries and death. For many years, officers only had few options: open hand techniques like fighting and firearms, and had a couple of things in between. So they're more likely to try to fight or wrestle suspects as opposed to just getting them controlled. So, for example, when I was working, we had pepper spray, a collapsible baton, and a firearm. Like, that is all I had, decision-making wise, and that's not a lot of choices. Now there's other options, tasers, like other things that police officers can use that increase the safety for both police and suspects. All right, I'm going to stop here for this week. If you have reached this point in the video, please email me the phrase "almost done," and you can receive 5 extra credit points that will be added to your assignment for this week. So, as always, please let me know if you have questions and make sure you complete your assignments.